It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante, and we're here on location again at the Health and Wellness Center at Hazleton. Folks, as I've been telling you, the healthcare just keeps on getting better and better and better. You recall when we had the acting president, John Fletcher. Now he is the president of the Lehigh Valley Hazleton division. And we had Terry Capuano on, who is the COO of Lehigh Valley Health Network. They talked about how the teams on both hospitals and the doctors in the healthcare system work together. So I thought as we continue on our process here of informing you of what's happening in the Hazleton area and the great health care we have, and I'm telling you folks, it's just exciting for everyone who lives in this area. Today, we're going to talk to two doctors. One doctor comes here quite frequently, the other doctor is here. You know him as Dr. Yaqoob Mohyuddin. He was on my show before, right, doctor?
That's correct.
And he told me he signed a lot of autographs, and he may decide to go in the television business, I'm not sure. Only kidding. But I'm also very happy to meet today Dr. Bozorgnia. Bozorgnia. Okay, what is that? What nationality is that?
I'm born in Pontiac, Michigan, which is not that exciting.
Oh,
but
that
it's
country. I remember that country, yeah.
Yes, it's Persian.
Oh, is it really?
Yes.
Yeah. How long have you been here in the country?
Born here, Pontiac, Michigan, but raised overseas for a little bit, but I've been here now for 25 years.
For those people who may not know of your background, I know you're well known in the Allentown area. Why don't you tell our viewers just a little bit about yourself, Doc?
Me and my family moved into the Lehigh Valley area, like I said, about 25 years ago. I went locally to Penn State for undergrad, and then big football fan,
oh, yeah?
still am. And then from there, I went to Philadelphia for the rest of my training and stayed at Temple University Hospital for medical school residency and fellowship, and went down to Florida for a few years just for practice, and my wife didn't like Florida, so we came back to the area.
She didn't like Florida. Yeah. She likes it in the wintertime, I'll bet.
Yeah, she just likes the mountains and the change of season.
And it's beautiful.
Yes, it is beautiful.
Well, when we're talking about the team, so you're part of, just specifically, what do you do, and what division do you handle in the healthcare?
So we are part of the Lehigh Valley Heart Specialist. There's 22 cardiologists over there. For our smaller group, we are the Electrophysiologist. The Electrophysiology is the subspecialty in cardiology. We are specialized in the arrhythmias, or the abnormal heart rhythms. So it's a subspecialty of cardiology, and our main job is to treat arrhythmias of the heart.
Okay, now as the team works, okay, Dr. Yaqoob, you're here full time, correct?
That's correct.
Now, what is your relationship then? How does this work, you know, between you and Dr. Bozorgnia?
So a little background in terms of how the cardiac subspecialties work. The heart is like a house. You have to have a general contractor, so I'm a general cardiologist. You have to have an electrician, which is Dr. Bozorgnia, an electrophysiologist. You have to have an interventional cardiologist or a plumber, and then you have to have the cardiac surgeons. So those are more like the guys who do the brick and mortar work. So basically, if the patients come see us for their heart rhythm or general heart issues, now if there is a heart rhythm abnormality, whether it's a fast heart rhythm or a slow heart rhythm, and we feel they need further expertise, we would refer them to Dr. Bozorgnia. And we're fortunate that they are in town. They come here once a month so that our patients don't have to leave the area, which is a huge burden on especially the elderly population leaving the area. So we're fortunate enough that they can get that care taken care of here. Now, if they need a specialized procedure, they have already had that established relationship with the electrophysiologist, and they can go down to Allentown for their procedure if they need to stay overnight, and then be back the next day.
So what is arrhythmia? What is that?
So the heart is capable of generating its own rhythm. Heart rhythm originates in the top right chamber of the heart. Every cell, or every cell in the heart, is capable of generating rhythm. It's like a fail-safe mechanism. So the driver, there are specialized fibers in the heart that conduct heart rhythm. or electrical impulses. So when we're sitting down, our heart rate can be 50, 60, 70, 80 beats per minute. When we're walking, as the demand of the body increases, heart rate increases. Now, arrhythmia happens whenever either there is an irregularity of the heart rate, the heartbeat, or either it's too fast or it's too slow. There may be a problem in the top chamber, there may be a problem in the bottom chamber, and depending on where the problem comes from, that also determines how dangerous it can be, and that's when we get the heart rhythm specialists involved.
Now, doctor, a person would know they would have some kind of arrhythmia, right? A person, what would be some of the symptoms or that would, you'd say, I think something's not right here?
Most commonly is presented with palpitations or irregular heartbeat. You might have heard this on TV or commercials where somebody shows up and they have, they say that the heart is racing or palpitation, but it can also present with a variety of other symptoms, dizziness, feel like you're going to faint or pass out. And again, as Dr. Mohyuddin eloquently alluded to it, it could be from either a very fast heart rate or a very slow heartbeat. So any symptoms of dizziness, feel like you're fainting, or palpitation, sometimes people describe as a bird fluttering in the chest, those type of symptoms.
What can cause this arrhythmia?
So any type of structural abnormality of the heart, somebody who's had a heart attack in the past, or congestive heart failure, which means the weak heart, or some people are just born for just lone arrhythmia of the heart, just malfunction of the electrical system of the heart. These could range anything between something benign or all the way to life-threatening arrhythmias.
So your advice to someone who may be experiencing something a little not right, okay? Person knows their body very well, okay? You know, sometimes they get nervous, you know, what if they find something, because I'm a big baby when it comes to doctors, believe me when I tell you that. So they should be, at least come in to get a physical exam, you know, something's not right, and then, like, what would be the process then when you know, if I'm not feeling right and I feel that something, I'm a little dizzy, doesn't mean that there's something major wrong, I mean, but you should get a check. What do you do then?
So the first step is getting an EKG, which gives us a 6-second snapshot of what's happening in the heart. So we put electrodes on the chest, on the arms, on the legs, and we see what the rhythm of the heart is, whether there are any extra beats, and that is a very a small snapshot in the long spectrum. So if we don't find anything there, and most of the times we don't, we have to have monitoring done, whether it's a 24-hour, 48-hour, or a month-long monitoring where the heart is constantly being monitored. And when patients have symptoms, when they feel the palpitations, they can press a button and then that can be recorded. And then we analyze it and look at it, what underlies, and then we can take it from there. Okay,
so now the working between you and Dr. Bozorgnia, right? I'll get that right, doctor. Yeah. Okay. How did then, because this is the health team, which makes it so fantastic, okay? So you find something that you cannot, well, not that you can't, but you need to go one step further. When does this working relationship begin to work so the people understand why the network is a great thing?
So we actually had this relationship before the two hospitals merged, and we've had a very strong relationship in the Department and Division of Cardiology with the two institutions. So what happens is patients, either they're established with our cardiologist locally, or they're referred for arrhythmias or slow heartbeat or dizziness, lightheadedness. We will evaluate them. And for most of the slow heartbeats, you know, patients may end up requiring a pacemaker. Those things can be taken care of in town. There are fast heartbeats, which are electrical short circuits, for which further therapy is needed, and that's predominantly when we get the electrophysiologist involved, or if the patient needs a defibrillator or biventricular pacemaker or what's called cardiac resynchronization therapy, and that's where our electrophysiology colleagues like Dr. Bozorgnia and his partner Dr. Altomos come into play. And you know, if you look at from a medical standpoint, we don't really cure a lot of things. But the technology that electrophysiology offers, we're really able to take care of some of these short circuits and cure a good amount of people, especially from from benign fast heart rates.
And so it's interesting because many years ago, I don't know if they had electrophysiologists around, but now we have people like you. And then so what part then do you play after he says we have to go another step further, okay? Where do you come in and what do you do specifically?
So as he mentioned, that we've been in a close working relationship for some time now, even before the hospitals merged. We're actually, in today's age, we're just a cell phone or a text away. So if he finds a patient or sees a patient that needs more complex things, we're just a cell phone or a text away. Usually we communicate with cell phones. And if it's something urgent that needs to be done right away, we will transfer the patient. If it's something complex, right down there. If it's something that needs to be routinely followed, we'll just see that patient on our next visit to Hazleton. As mentioned before, one of us come here at least once a month. We're hoping maybe more down the road to provide care as a health network. We like to be a network, so we actually enjoy coming up here. I always say that in a big hospital center, you don't want to lose that personal touch, either with your patients or with our community doctors that we work with.
You brought something up that I think is really interesting, the both of you. For the many doctors that I know in the area, the bedside manners, are there. I mean, I'm seeing it where there's compassion, where there's a concern. It's not like, oh my gosh, you're up here and the patient's here. Because don't forget, person's sick, they're nervous, they're scared, they want to be comforted, and that's where I think the doctors, in the Lehigh Valley Health Network has been just great. As far as and also the healthcare, I've always said this, that the nurses, the aides, they all play a part. The secretaries, they're all a part of the system. But knowing that we have the advanced technology, what are some of the things you would do then if there's arrhythmia or if there is a atrial fibrillation? So
we provide a variety of advanced technology, as Dr. Mohyuddin mentioned. Simple pacemakers, which are for slow heart rhythm, can be done locally, but if it's a high voltage device like implantation of defibrillators, those are for sick hearts, people who've had heart attacks in the past, or more sophisticated device. We implant those. Those are the.
Is that a major procedure, doctor?
It is a minimally invasive procedure. It is not open heart surgery, but the device does go under the skin with the wires attached to the heart. So it can be, lengthy, but it's not open heart surgery. We also do ablations, which is one of the main things we do, is where it's like a catheterization. We go through the veins in the leg and we come up to the heart. And we try to find those short circuits that cause the heart to go into arrhythmia and get rid of them. It's amazing. Folks, I'm here at the Hazleton Health and Wellness Center at Hazleton. We'll be back with more information. This is exciting, folks. Stay with us. Welcome back to the Sam Lesante Show, folks, and we continue our health network at the Lehigh Valley Health Network, folks. It's a passion for better medicine, and I'm here on location at the Health and Wellness Center in Hazleton. And if you just tuned in, we're talking to Doctors Bozorgnia. I said that right? And Dr. Yaqoob Mohyuddin. And Dr. Mohyuddin's here most of the time, and Dr. Bozorgnia comes up from Allentown once a month to treat his patients. Now, we're talking about arrhythmia of the heart. We all have one, folks. Some people think I don't have one. Some people say, do you have a heart? I say, I don't know, it's somewhere in there, okay? But atrial fibrillation, okay, what is that? How is it treated? How do I know if I have it? Atrial fibrillation is the most common arrhythmia of the heart. It's also commonly known as the irregular heartbeat, mainly because it makes the heartbeat irregular. The most common symptoms of it is palpitations, rapid heartbeat. Sometimes people feel fine and then all of a sudden feel the heart racing for no good reason. It's very common. It's an arrhythmia of aging, so it becomes more common as we age. A high percentage of patients age 65 and older have atrial fibrillation. While it's not an acutely lethal arrhythmia, meaning it doesn't cause death or heart attack right away, If it goes untreated, it can cause a couple of problems. Number one, it can make your heart rate go fast, and if the heart rate is going fast for no good reason for a long time, it can cause heart failure, congestive heart failure. The other thing it can cause is a stroke, mainly because the top chamber of the heart is fibrillating like this as opposed to beating normally. So blood sort of slushes around instead of moving appropriately through the heart. Every time blood sits around, little blood clots can form. If that dislodges and goes upstairs, it can cause a stroke. So very common problem and can have a lot of bad side effects and morbidity and mortality if it goes untreated.
Okay, so what do you do to treat it?
So the first thing that we do acutely is try to control the heart rate to address those problems. Number one, make sure the heart rate doesn't go too fast so the heart doesn't get weak and tired. The other thing that we do is we thin the blood or start anticoagulation to prevent strokes. Those are the immediate things that we do, but then moving forward, we try to get those patients back to normal rhythm and keep them in normal rhythm. And there's a whole slew of therapies and treatments that are available.
Okay, so once again, you know your body better than anybody knows their body. So people don't jump to conclusions, because sometimes, you know, we do a show like this, someone says, oh, I got that, or maybe they ran up the steps, or they're doing some exercise, or something happens, and, you know, they're you know, they're short of breath, etc. That doesn't mean they have a heart problem. You're talking about just normal existence where things are happening without you doing any extraneous exercise, going up the steps, carrying the clothes, or okay, so this would be something that you should address if it's, you know, it shouldn't be happening because you're not doing anything. Okay. What are percentages? Okay, we all know, as Dr. Yaqoob had said, we should get to the doctor at least once a year for physical example. We know that. If you're not, it's a shame. But what are the percentages when you do find something, you know, that is not normal in the heart? Is it your percentage is higher when you get something? Well, that's a stupid question, but I know the answer. Is it higher when you first go to the doctor, or, you know, is it the same if you waited 3 months or whatever?
Well, it depends. Arrhythmias tend to come and go. So certainly if you have the symptom, it helps if you present to the physician right away so we can capture those rhythm, as Dr. Yaqoob mentioned, with a heart monitor or an electrocardiogram to capture those arrhythmias. But we often deal with, you know, patients come in and the arrhythmia has already passed, and we're trying to capture those. There are now heart monitors that we could have patients wear for 2-3 weeks at a time to sort of, you know, expand the window of opportunity to capture those arrhythmias. But certainly if you feel something is wrong, don't take it for granted. You know, come to us and we'll take it from there.
Yeah. Dr. Yaqoob, how common is a tribulation or arrhythmias in families? I mean, let's say if your father had one or your uncle had one, etc. How common is that?
So true familial arrhythmias tend to be very rare, but usually there's an underlying cause for an arrhythmia, usually, as Dr. Bozorgnia mentioned, a structural heart disease. So the heart has to be either weak or have some sort of, you know, there's a disease where you can have fatty deposition in the heart, and those can run in families. Those are genetic diseases, but for the most part, true de novo or new arrhythmias of the heart are fairly rare. They're always or almost always due to something. Some fast heart rhythms from the top chamber can also run in families. Atrial fibrillation rarely can run truly just familial atrial fibrillation, but overwhelming majority of arrhythmias tend to be due to some other problem of the heart.
Okay, folks, I'm up here at the Health and Wellness Center at Hazleton, and we're talking to Dr. Bozorgnia. I'm going to teach him how to say your last name, and Dr. Mohyuddin. And we come back, we'll talk about the health team, okay? We have two doctors here that work very close together. What about the entire team and all the expertise you get when you really need health care? Stay with us. Welcome back to the Sam Lesante Show, folks. Remember ssptv.com 24/7. My email is sam@ssptv.com, and if you want to see all of the health shows I've done, just go to our website, hit the Sam Lesante Show, and you'll see all the shows we've done a lot of great information, folks, that you're getting from professional doctors and this Lehigh Valley Hospital, Hazleton, the teamwork, the merger, takeover, whatever it may be, is just fabulous. If you recall, I had the now president, John Fletcher, and the COO, Terry Capuano, on the Sam Lesante Show, and they explained just exactly how this is going to work, and it's working fabulously. So I was just talking to you on the break, Doctor, the team, okay, how does this whole thing work when you need additional information?
Right, so as a health network, Lehigh Valley Health Network, it allows us, when coming to a place like Hazleton, it allows us to provide those type of technologies that are not necessarily available in all the communities to all the patients that are out here. So this could be anywhere ranging from simple nutrition and health and wellness recommendation, all the way to very complex procedures, devices, open heart surgeries. Lehigh Valley Hospital is the third largest hospital in the whole Northeast United States, so we have a lot of technology that's available to us, and by coming out to the smaller communities, we can link those patients and make those things available. So just because you like to live out in the country in a small place doesn't necessarily mean that you don't have access to all the technology that is available if you lived in the middle of a big city or a metropolitan place.
Okay, now once again, explain that you are an electrophysiologist.
Right.
Okay, big word, folks. Took me 10 minutes to learn how to say that. What is it?
So electrophysiology, as I mentioned before, is a subspecialty of cardiology where we are trained and specialized in treatment of the arrhythmias of the heart. So heart has the electrical system and the plumbing system. We always joke that for the heart we have the plumbers and the electricians, so we are the electricians of the heart.
So let me ask you a personal question. Why did you go into that part of medicine? You know, because you could have gone into any other area of medicine. Why did you go into that part of medicine?
The electrical system of the heart requires more of an engineering background, physics, so it's sort of a nice merger of organic type medicine with sort of the electrical physics. So if you like physics and those type of things, you sort of like that. It also involves, complex procedures that, is attractive. When you try to help patients, you can actually physically do something.
Well, you bring a lot of great expertise to our area here, and we hear a lot of great things about you. And you're a fine person, too. You really are.
Thank you for having us.
It was my pleasure meeting. Well, let me get the TV star, Dr. Yaqoob.
That's right.
This is his second appearance on the Sam Lesante.
That's right.
He says, as the ratings keep going up, he says he's going to push me out. Okay. So, Dr. Yaqoob, we're talking about arrhythmias of the heart. Okay. So, once again, for people who are just tuning in, tell us exactly what this arrhythmia is.
So, arrhythmia is an abnormal heart rhythm. Anytime you have extra beats, either from the top chamber, the bottom chamber, or irregularity in the heart rate too fast, and let's say you're sitting down, your heart rate's beating 180 beats per minute, that's not normal, that is an arrhythmia. Or if your heart rate is too slow to meet up the body's needs, whether it's due to a problem between an electrical disconnect between the top and the bottom chamber, or it's that the intrinsic heart rate is slow, that all is an arrhythmia. So anytime the heart is out of rhythm, it's called arrhythmia. So a normal rhythm would be the top chamber squeeze. The top chamber has electrical activity. It squeezes. The bottom chamber gets that electrical activity. It squeezes. And so there's top and bottom squeeze. And anytime the electrical impulse is abnormal, you tend to lose some of that synchrony.
Now, you know if something's not right. Correct? I mean, here again, what are some of the symptoms?
So the symptoms
and some causes as well.
So the symptoms of arrhythmia would be palpitations, feeling extra heartbeats, fluttering in the chest, lightheadedness, dizziness, heart racing too fast. At times people can pass out. Some of the causes of arrhythmia depends on what the arrhythmia is, but the overwhelming cause is heart disease, whether that is due to weakness of the heart muscle or it's due to prior heart attacks, or in the absence of any structural heart disease, you can have native electrical disturbance, which tend to be less common, that can cause arrhythmias.
What are some things that prevent some of these things happen? What can a person do? Could it be exercise, diet? You know, I don't know. What would be some of the things that we should be? Because you said, doctor, over 65. You know, I have another 30 years to go yet before I hit 65. But don't be laughing at me, Mary. Some of the things that people could do, you know, that if there's anything to prevent something like this.
So in order to prevent arrhythmias, you got to prevent the underlying cause of the arrhythmia. So for society today, the number one cause of ventricular arrhythmias, or the arrhythmias in the bottom chamber, would be heart disease. So preventing heart attack, you know, watching our diet, exercising, and not smoking. So taking care of the risk factors that cause heart disease would be, it would in long term lead to arrhythmias, and would prevent that. Now, the arrhythmia atrial fibrillation, the biggest cause is high blood pressure and age. We can't really do much about the age part, but high blood pressure we can certainly control by, again, seeing your doctor, limiting salt intake. The other thing that's fairly common in sleep apnea, especially as the population is getting larger in terms of weight, is obstructive sleep apnea, where when we sleep, the airways collapse and we don't get enough oxygen. That can cause stress on the heart, and it can lead to specifically atrial fibrillation and high blood pressure.
Thank you for all the great information, and you're doing a great job up here, okay?
Thank you.
Folks, I'm talking to Drs. Mohyuddin and Dr. Bozorgnia. Folks, as you know, most important thing is, first of all, stop smoking, okay? I'm coming in here, I two people smoking, and I'm giving them a lecture. Do not smoke. Am I correct on that?
You're absolutely right.
Second thing is, get to the doctor, get your physical examination so you know where you stand. We have a great health source here. You can't find a better health system in the United States. Believe me when I tell you, folks. So there's no reason for you to get strokes or whatever. Take care of yourself, because you have a health care network second to none. That's Lehigh Valley Health Network. I like their slogan, a passion for better medicine. Once again, if you want to watch any of my shows, health shows, just go to our website, sam@ssptv.com, and my email is sam@ssptv.com. We'll see you next time.